Can people mix herbal medicine with traditional, depending on the condition? And do you find that most traditional physicians are becoming more and more open to combining?
Yes and no. The people that really, the integrated docs that really delve into learning integrated medicine and so get rid of the fears of herbal medicines, they're doing it. They have no problems doing it. And for example, in Germany too, in the up until the early 1990s, it was routine practice that you would use herbs and drugs simultaneously. Again, yesterday I'm talking to a natural products chemist from Germany, who I just met for the first time, but we know a lot of the same people. And he himself was telling me, yeah, we would give, as a pharmacist, we would fill the prescription that the doctor gave and then give an herbal tea. Almost always give, like a chamomile tea, in conjunction with any GI or any sleep drug that was prescribed. It was routine. Germany used to also do an interesting thing. When they would, a lot of times when somebody has a weak heart, and they might be prescribed digoxin, a digitalis glycoside synthetic drug, used to be derived from digitalis plant. But it's really strong, and it might not quite be indicated yet. So what the German doctors would do, they'd say, take your digitalis in the morning, take hawthorn in the middle of the day, take digitalis at night. And then as the person got stronger, they'd reverse that. Take hawthorn in the morning, take digitalis middle of the day, take hawthorn at night. And then ideally you'd wean them off of everything. Same thing with anti-inflammatories. They'd say, you know, you're not quite there, you know, that you need a really hardcore anti-inflammatory, so we'll give you the aspirin or NSAID in the morning, take willow bark in the middle of the day, and take an NSAID if you need it at night. And then reverse that, take willow, NSAID, willow. So there was a complete integration. But because the greatest fear that physicians have are negative interactions, most of which have been stimulated because of in vitro work, not really clinical work. So you look at St. John's Wood, that's like the poster child for herb-drug interactions. Well, there's a dear friend of mine who's one of the leading medical researchers on depressive studies and Alzheimer's for the National Institutes of Mental Health. He considers most of it bunk. Because it was all most of it was based on in vitro work, or the changes in drug profile that were being seen were not resulting in clinically relevant changes in parameters. So maybe the area under the curve in the bloodstream of the drug was changing, but it didn't change the clinical effect of the drug. So so there's a lot of misinformation, and there's still a lot of fear about using drugs in conjunction with natural therapies. But somebody who's really is used to good patient management care, no problem whatsoever. And there are with exceptions. Garlic, you would never take garlic in conjunction with something like garlic or Chinese salvia or Dong Quai in conjunction with blood thinning medications, because they do have clinically relevant effects on thinning the blood. So there's reality to some of the adverse effects, but it's been exaggerated. But anybody who's really skilled at it, or not even really skilled, just knowledgeable about the management care, there's no problem whatsoever.